Local hospitals are gearing up to go all out. November 15th marks the 30th anniversary of the National Great American Smokeout, an annual event sponsored by the American Cancer Society. To stress the importance of this event, Memphis area hospitals chose this day to kick off their new tobacco-free policy. As Rod Starnes shows us in our cover story, this united effort is proving to be a breath of fresh air to just about everyone.
Take a good look now. Pretty soon, signs like this will be a thing of the past, because this is a sign of things to come. As of November 15th, all Memphis area hospital campuses will be completely tobacco-free zones. The new policy will prohibit the use of all tobacco products on any hospital property, including parking areas and previously designated external smoking sites.
It affords us the ability to have a major impact on the health of the community by coming together, and I think it's important that healthcare organizations are stepping forward to be united in that front.
We know from the Surgeon General's report of last year that secondhand smoke takes a heavy toll, not only on adults but particularly on children too.
There is no acceptable limit or safe limit of secondhand smoke, and we need to do everything we can to eliminate secondhand smoke from our environment because it causes significant disease and in some cases death. Secondhand smoke is bad for your health.
Of course, hospital interiors have been tobacco-free since 1991. But since the Surgeon General released that report last year regarding the dangers of secondhand smoke, there's been a major push worldwide to create tobacco-free zones just about everywhere. That's good news for non-smokers, but a real challenge for those who are hooked on the habit.
Just talking to people isn't going to convert them because they know that. I mean, they know the dangers of smoking. And we certainly share those statistics with people because people need to have facts, but beyond that they need more support than that. And while we announced that we were going to go tobacco free, we gave people a long lead time, so that was important. They had 6 months from announcement date to launch date. And secondly, we really at the same time told them all the things we were going to be offering them to help those who wanted to quit smoking.
Can I see a show of hands, please, of who is tobacco-free as of today? Wonderful, wonderful.
Employees at all of the hospitals participating in the All Out campaign can take smoking cessation classes, such as this one, free of charge. They can also call telephone quit lines, staffed by master's-level counselors. And some hospitals are even providing free nicotine replacement therapy.
We don't take this lightly. And we understand that this is a major effort, a joint effort. So the resources are available for you to take that help. But you need to take the first step.
I'm excited about it. At first, I was like really upset, because I felt like I was being forced to do this. And then my kids, of course, my children have always been, Mom, you need to quit smoking, you need to quit smoking. And I'm like, okay, so I was like, well, now's my opportunity.
Denise is now 6 weeks tobacco-free and proud to be completing smoking cessation classes with her coworkers. For hospital officials, getting employees to work along with the new guidelines is just one obstacle to overcome. Another tobacco-free challenge facing the healthcare community is in the area of mental health.
The psychiatric population tends to have more tobacco use, and there tends to be more anxiety among staff whenever we want to talk about going tobacco-free.
With that concern in mind, Dr. Fisher and her colleagues got the word out more than a year ago that their facility was going tobacco-free. Memphis Mental Health actually launched their tobacco-free campaign in July, and the results for the patients were better than anticipated.
There's actually a decrease in behavioral problems. They really welcomed the opportunity because here was an opportunity to quit using tobacco and, get nicotine replacement patches, do it in a therapeutic setting with other people going tobacco-free at the same time, be surrounded by counselors and support staff.
And that's really the key when you're going tobacco-free, a strong support system.
You're not alone. You're not alone. You have people who are going through the exact same thing you're going through. They're feeling the same things. They're thinking the same things, and that's a good thing. That helps me a lot, is knowing that I'm not alone and that, I have somebody that I can talk to.
So if you or someone you love is a smoker, get ready. Make a note in your PDA, set the appointment on your laptop, circle the date on your calendar. November 15th is just around the corner. Time to get in on the push to go all out. For Smart Medicine, I'm Rod Starnes.
Joining me now from the American Cancer Society is Dr. Claudette Shepard. And Dr. Shepard, thank you so much for joining us.
Glad to be here.
Well, I know the American Cancer Society for years and years has supported efforts to help people stop smoking.
That's true.
But why has the society gone and stepped out and really encouraged this non-smoking, smoke-free environment in the hospital initiative?
Well, because it's the culmination of everybody understanding what we've been trying to promote. If we have hospitals such as Baptist Memorial Hospital, the Med, the Methodist Hospital System, encouraging a smoke-free environment, that allows us to get our message out that we've been doing this for years. And the Great American Smokeout, as you know, is what we do every year. I
understand recently the state of Tennessee passed a law that made workplaces tobacco-free, and this must be very encouraging for the American Cancer Society.
It is, because we know that secondhand smoke is almost as bad as straight-up smoke. And it's important for people not to have to make a choice between a paycheck and good health. So we applauded that effort.
What kind of things would you recommend for those who have an especially difficult time stopping smoking?
We find that many times it's not the addiction per se, because you get over that with time, but it's the habit. What you did when you smoked, if you had your coffee with your cigarette, if you read your newspaper and had a cigarette. It's those things that are associated. People fear that they're going to gain weight, so they don't want to gain weight, they'd rather smoke. So you have to plan for something else. So start an exercise program before you quit, because we know that quitting cold turkey does not work. So you need to really have a plan 6 months out and then set your quit date.
Dr. Claudette Shepard, thank you so much for being here representing the American Cancer Society. Delight to have you today.
It was my pleasure.